There's an old episode of The Simpsons where Homer has to go to a mental health care facility for wearing a pink t-shirt to the power plant. There's a lot of one flew over the cuckoo's nest jokes, and Homer even meets a man claiming to be Michael Jackson. But there's a specific moment I want you to remember. It's the moment where Homer's released from the hospital and begins furiously scrubbing at the back of his hand trying to remove the ink stamp which labels him insane. That episode aired in 1991, and that scene is still really funny because, like a lot of the best jokes, it is honest and timeless. This is an election year in Newfoundland and Labrador. It's actually an election year everywhere in Canada, but Newfoundlanders and Labradorians get to go to the polls twice because we also have a provincial election. Now, elections can mean a lot of things. Big changes! Or staying the course. But what I'm afraid of is that we'll actually get both. Here's what I mean. This past year, there was a real push from the people of this province to end the stigma surrounding mental health issues. And that has been a beautiful thing to see. I hope we continue in this direction because no one should ever have to face fear or humiliation for seeking medical help. So cultural problems? We're on it and we'll get there. What we can't lose sight of though is that once someone does decide to come forward, we need to have the resources they need in place. And right now, we can do better. In this province, the treatment someone receives for a physical health condition versus a mental health condition are shameful. A 2015 report from the Canadian Mental Health Association found that the mental health care system in Newfoundland and Labrador is, and I quote, inaccessible, full of barriers, and perpetuates stigma. They go on to say that despite the long-standing need for new facilities and better access to services, the message from our government and the mental health care system has been that they do not matter. And that's a hard point to argue against. Back in May when Health and Community Service Minister Steve Kent was trotted out to declare May 4th to 10th Mental Health Week, he was quick to talk about the government's commitment to awareness. And that's great, but what about the new hospital you promised? There are no funds to advance this project. The Waterford Hospital was built in 1855, and the conditions that patients still endure inside have been called human rights abuse by mental health care advocates. The building is dilapidated and built around an antiquated view of what a mental health care facility should provide. And this isn't news. This isn't something politicians found out about recently. They know, and have known, and have been promising a new facility since 1971. So please don't think this is me picking on the Conservatives, because everyone had a hand in ignoring this issue. But it's campaign season again, so bring on the promises. Liberal leader Dwight Ball said this new facility is not a nice to have, it's a must have. It's a project we can't afford not to do. He said if elected, the Liberals would ensure a new building is begun by 2017. NDP leader Earl McCurdy said that replacing the Waterford Hospital must be a priority for any government. And the Conservatives are still promising a new hospital, but we're just not going to get it as soon as we all hoped. Look, I know a new hospital won't solve every problem we have with the mental health care system in this province, but I think if we're all ready to end the stigma associated with mental illness, then we owe a lot better to those who decide to come forward and ask for help. Ending the stigma? That's a great start, but actually being able to help those in need is the next logical step. We've asked for better from ourselves, now it's time to ask for better from our elected officials. Let's not let another government wash its hands of this issue because this is one problem that can't be scrubbed off. Just ask Homer.